Hi everyone, my name is Kelly Ieong and I'm a resident from Stony Brook Hospital. I'd first like to thank SAGES for giving me the opportunity to present my research. We will be talking about the bone mineral density changes after bariatric surgery. I have no relevant disclosures. Bariatric surgery is the most effective treatment for obesity, with maintenance of weight loss and remission of comorbidities. Roux-en-Y gastric bypass is known to accelerate bone loss and increase fracture risk. In recent years, sleeve gastrectomy has become the most commonly performed bariatric surgery in the States. However, data on the effect of sleeve gastrectomy on bone mineral changes remains sparse. The objective of our study is to, number one, evaluate changes in site-specific bone mineral density after Roux-en-Y gastric bypass and sleeve gastrectomy, and number two, to assess risk factors associated with bone mineral density changes. A retrospective review was performed on a cohort of patients who underwent bypass and sleeve from June 2014 to June 2016. Inclusion criteria include patients who had DEXA scans within 12 months preoperatively and 24 months postoperatively. Exclusion criteria are patients on estrogen hormone replacement therapy. Table 1 demonstrates the patient's baseline characteristics and biochemical parameters. There were 42 patients in total. 24 underwent Roux-en-Y gastric bypass and 16 underwent sleeve gastrectomy. At baseline, no significant differences in characteristics and biochemical parameters were noted between the two groups. This table demonstrates the effects of bariatric surgery on clinical parameters. Bone mineral density in all areas were significantly decreased in Roux-en-Y gastric bypass patients postoperatively. BMD at femoral neck, femoral trochanter, and total hip were significantly decreased in sleeve gastrectomy patients postoperatively. BMI and calcium were significantly decreased in Roux-en-Y gastric bypass patients postoperatively. And similarly, BMI and calcium were also decreased significantly in sleeve gastrectomy patients. A multilinear regression analysis was performed on significant variables on univariate analysis to determine risk factors associated with the negative bone mineral density changes at each site. According to these results, there is no significant difference between surgery types on changes in bone mineral density. Serum calcium was found to be a risk factor for bone mineral density change at the femoral neck, and vitamin D level was found to be a risk factor for bone mineral density change and T-score change at the lumbar spine. In conclusion, all patients were found to have decreased bone mineral density after Roux-en-Y gastric bypass and sleeve gastrectomy. Surgery type was not a significant risk factor in bone mineral density change. Despite vitamin D and calcium supplementation in all patients, decreases in vitamin D and calcium levels were associated with a decrease in bone mineral density. Close follow-up and treatment of vitamin D and calcium levels are warranted in all bariatric patients. Thank you for your time. I'd be happy to answer any questions through the platform, or please email me directly at the above email address. Have a good day.